All right. Happy Wednesday, everyone, and thanks for joining us as we once again focus on COVID-19 here in Orange County and the business efforts and recovery. Discussion this afternoon will include information on new testing sites in Orange County, progress of the Orange County Economic Recovery Task Force. Mayor Demings will discuss that. Dr. Martinez will discuss some of those testing sites along with Dr. Pino, the director of the Florida Department of Health here in Orange County. We are also joined by Orlando Mayor Buddy Dyer and our Sheriff, Orange County Sheriff John Mita, with the latest details in the city of Orlando and local law enforcement efforts here in Orange County. We begin our press conference with comments from our Mayor, Jerry Demings. Mayor.
Thank you, Dr. Williamson. Thank you to all of you for being here as we give you an update about just where we are in our community. We've been very active today. I had the opportunity to go out to one of our testing sites there in the 32822 zip code, and I had the opportunity to witness one of your colleagues today, and she went through it with no problems, and so she stood as, I think, a shining example of being willing to take the test, and that's what we are encouraging people to do in our community, to go if you haven't been tested and you desire to do so, to do that, because that's part of the focus this week, is to increase the total number of tests. This afternoon, we're going to try to get through this press conference fairly quickly, because I know that Governor DeSantis will announce his recommendations at 5 p.m. today, and all of you want to be part of that. The most frequent question that I have been asked in the recent past is, when will Orange County reopen? And in answering that question, we will take recommendations from the governor on the advisement, and we will have more to say about that tomorrow. Members of the Orange County Economic Recovery Task Force have been working really furiously to come up with guidelines for our community by the end of the week. 4 working groups from the task force met today, and they are scheduled to meet each day this week. I had the privilege to participate in several of the meetings today and yesterday, and I look forward to continuing that. 4 working groups from the task force met. One was the reopening business working group task force or subcommittee, which had experts from Advent Health and Orlando Health included in the discussion. The group is working to come up with guidelines for businesses to follow when they reopen. The Business Readiness Working Group is creating a business checklist and how businesses can obtain personal protective equipment. Others who met today were the Bringing Back Tourism and Business Compliance and Consumer Confidence working groups. Members of these subcommittees are meeting in the next several days to have final recommendations by the end of the week. The entire Economic Recovery Task Force will meet at 2 p.m. on Friday. How we reopen Orange County must be done with extreme care. The issue with this disease is the explosive way in which it spreads. We do not want to open too quickly without a solid plan in place with countermeasures to keep employees and our residents safe. We want to make sure our residents and all of the people who work at our businesses feel comfortable when they go out in the public and to their jobs. We want the approach to be measured and sensible. We know from our infectious disease experts that a second round of the coronavirus is likely to occur. It has been 5 weeks since Orange County residents have been under the stay-at-home order, and I would dare say that it has worked. New cases continue to grow, however, but we are not finding the number of cases that we were looking at just 3 weeks ago. We're not seeing the type and numbers that many of the predictive models said we would realize at this point. We're in much better shape than that, and we want to continue to be in better shape than what the models predict. In early April, we were doubling the number of COVID cases every 72 hours. Obviously, that has slowed considerably at this point. In fact, on April 26, no one was reported hospitalized for the coronavirus in this community. Looking across the hospital systems here within this community. Dr. Pino will share more, like he normally does with you, about the specifics and the data. Orange County now has 1,371 confirmed cases of the coronavirus, which is an increase of 8 cases from yesterday. 8 individuals with all of the additional testing, only 8 tested positive yesterday. There are 33 deaths. Orange County now has tested over 33,000 individuals. 2 new test sites opened today for Orange County residents by the Orange County Health Services. That consisted of staff from our medical clinics here within Orange County, as well as firefighter paramedics who were out assisting in taking tests from the various people. In response to the coronavirus cases found in the 32822 and 32824 zip codes, we do have 2 of our county commissioners here with us today, Commissioner Maribel Gomez Cordero as well as Commissioner Uribe, and they were both champions of getting additional testing in those zip codes. So good job there, and hopefully you've been tested as well. If not, maybe you will be, right? One testing site was at the South Orange Sports Complex, the other at the Ventura Elementary School, where I had the pleasure, again, of going out and watching our healthcare professionals in action. Those are certainly the heroes of fighting this pandemic on the front line. At this time, I'm going to ask Dr. Yolanda Martinez to talk about the sites and how residents can get appointments. So, Dr. Martinez.
Good afternoon.
You'll do Mayor Dyer.
Introduce Mayor Dyer. Good afternoon to everybody. I hope everybody's doing well today. As Mayor Demings mentioned, Orange County Health Services, in cooperation with Fire Rescue, Orange County Fire Rescue, as well as Orange County Sheriff's Office, thank you very much, Sheriff Mina, and the Orlando Police Department, opened 2 sites, one in Ventura Elementary School in the 32822 zip code, and we had the appointments completely filled. Actually, it went a little bit over. We were able to meet all of our appointments. Approximately 68% of the people that registered or made appointments for that site live in 32822. For 32824, we opened, as the mayor mentioned, at the South Orange Youth Sports Complex. There we had 156 appointments for that location. Of that, 58% were people that live in the 32824 zip code, and the other 18% 32837, which is the adjacent zip code, if you're all familiar with the map, and that also shows a heat zone in that location. So we had a very good day today. It went very smoothly. We even took some people that did not have appointments that did show up. We are stressing the appointments because it helps us with the process, and it helps those individuals that want to be tested to know that if you made an appointment at 2 o'clock, you're going to be seen around the 2 o'clock area or so, not necessarily have to wait out there in your car in the heat. So our plan is to continue the testing through Friday. We have all the appointment slots complete through now, but we're working on expanding, if possible, on Friday, being able to add more appointments. And if that happens, we'll make sure to have our Orange County communications team get that information out to the community so that they can go ahead and register. So with that, I'd like to turn it over to Mayor Buddy Dyer.
Thank you and good afternoon. I wanted to start today by thanking our many local not-for-profit groups in our community who continue to serve our residents in this very difficult time, including the Victim Service Center of Central Florida. And today I'm supporting their efforts to help victims of sexual assault by participating in Denim Day, which is a worldwide day that supports survivors and raises awareness about the role we can all play to stop sexual violence, and always look for an opportunity to wear jeans as well. I want to thank Mayor Demings for his continued partnership as we continue to fight the spread of COVID-19 and as we work to create a thoughtful, methodical plan to phase our community's economy into recovery. I want to thank the members of the Economic Recovery Task Force for the critical role that they are playing. And I'm pleased to see, Mayor Demings, that they are putting the safety of our citizens first. As we all know, we can't have economic health without public health. And while we don't yet have a vaccine or a treatment for the virus, we do have data and we do have science to base our decisions off of. And I can't say enough how proud I am that together we've been able to control the spread of this virus and get to this point where we can reimagine our new normal and plan for it today. But our work isn't over, and while these plans will provide a path to gradually and safely restart our economy, it must not lure us into thinking that we're going to go back to business as normal, because the virus is still going to be here and life is not normal. The hard truth is that we are building a new normal, and it will be a different way of life for everyone and a different way of doing things to keep us all safe. Together with many businesses across our city, we've been making preparations and decisions on how the city will operate as we start on this new path to the new normal. And over the last month, the City of Orlando has continued to provide critical services to our residents and businesses, with more than 300 of our services online. And while many of our employees have been working remotely from home and most of our facilities remain closed, because we've been able to continue to serve our residents and businesses remotely and to further ensure the safety of our employees and the public, we will continue to maintain our current remote working status through the end of the month of May. Additionally, City Hall and most of our city facilities will remain closed to the public also through the end of May. During this time over the next month, we'll further evaluate our operations and every service that we provide, department by department, to determine what services we may need to bring back and have employees on site to deliver, while also developing new processes and policies. And I'll give you an example. Understanding that our students are not going to be in school, one service that we're evaluating, and probably the most important at this point, is our summer youth programs and how we can get that operational again. Some of the safety measures we're exploring implementing include temperature checks upon entering our facilities, both for our employees and our visitors, adapting workspaces to ensure 6 feet of physical distance, adding even more hand sanitizer stations and hygiene signage. We're also exploring mandating face coverings when in our facilities, both for employees and the public. We're looking at limiting the number of employees occupying a space or a meeting room at any one time. We're exploring alternative work schedules and some longer-term remote working scenarios. In our new normal, as we all work together to bring our economy back, we must all continue to simultaneously and relentlessly continue to fight and reduce the spread of the virus. Testing must continue and remains critical to moving our recovery forward responsibly. I'm proud today that we partnered again with the Department of Health at Camping World Stadium. I'm told that we tested over 400 people today, showing that that is a location that needs the testing. The testing site at Ventura Elementary School has already been mentioned, but I'll re-mention that it is free and it's open from 9 to 4. As we begin to prepare to move into a new phase in recovering economically while we fight this virus, it's important for all of us to understand that our critical actions will still be needed on an individual level, a business level, and a community level. Together, our entire community has made great strides in keeping the spread low, and I know that we can continue to keep it up. Thank you. Dr. Pino.
Good afternoon. As the mayor informed, we have 1,371 cases and a positivity rate percentage of 5.6, which is 1.1 lower than before. Monday we have 5.7, so it continues to go down even when we continue to increase our testing. About 25,000 people have been tested in the county, for close to 2% of our population. And also, as you realize, we have new fatality added to our list, and our condolences with their families. A 70-year-old female, white, non-Hispanic. We don't know the exposure, and there were some pre-existing conditions. The day of death was on the 26th. A 60-year-old female, black, non-Hispanic. The exposure is unknown, and there were some health issues as well. And a 65-year-old male Hispanic. The exposure is unknown, and we don't know of any pre-existing conditions. This week, we have conducted our second week of testing, mobile testing, that we have continued to do. Initially, we were designed to do it for a week. We got enough supply. We did another week. Next week, we are planning to hit a pause in our mobile testing, as we need to restock in some of our supplies. And also, we want to disinfect our equipment and our mobile units, as well as a little bit of regrouping and maybe rethinking our strategy as we move into a new phase. And I can give you some ideas of what it's looking like. Next week, by Wednesday, we probably will announce a schedule for the following week. So the week after next, we will take our mobile testing, and it continues to be very successful. We are hitting close to 500 people a day. Today, we did 494 at Camping World, but the results continue to be on the lower end. Just to give you an idea, on Monday, we reported Monday, but Wednesday, we tested 365 individuals. 10 of those were positive. One was previously known, so we have 9 new cases on Thursday out of 365. On Thursday, the 23rd, we tested 400 individuals. 4 positive, 2 were new, 2 were previously known for us. That's about 1% rate. Since we start doing the mobile testing, up to today, including today's number, we have tested 2,258 individuals in the mobile units in 2 weeks. And we also so far have tested, in addition to that, 771 individuals on our East Side clinic, which is it's a smaller operation. Since we will not take the win, all those appointments will be honored on Saturday. So we are moving on operations from tomorrow to Saturday, and the calling center, which I'm happy to announce, is fully running without issues. The calling center is calling the individuals back home to let them know that the appointment will be honored on Saturday. Our new initiative may include, we are going to develop rather quick a mobile unit, very small, which the capacity of doing about 50 tests at any time. The idea is that we will have the ability to move into outbreaks in smaller areas without having to tailgating everything that we have in place to be able to do mobile testing. So this week we also will prepare to develop that strategy where we can go to census block areas or businesses and do and test and contain future outbreaks going to have. With that, I would like also to inform that for Barnett Park, for tomorrow's appointment that has been transferred to Saturday, we have 420 appointments already. From Blanchard Park on Friday, we have 465 appointments. Another strategy that we are going to take on is at our home, and some parents are at home, we are going to try to open 2 immunization clinics in 2 different sites of the town so that kids can start getting immunized for the school year. So as we want to make it as smooth as possible for families to go back to school, for kids to go back to school. Why we are going to concentrate in this first phase on 7th graders. Moms, dad, grandparents, uncle, custodians and guardians. Any child who is going into 7th grade in our county is going to have their immunizations updated. And we will open 2 clinics in the county, probably in 2 weeks, to engage in an effort to clear all the 7th graders before the summer so that we can concentrate our back-to-school event in kids that are starting school for the first time. I will introduce Sheriff Mina and will answer any questions of you when you have those.
Thank you, Dr. Pino. And before I get started, I just wanted to express on behalf of all the law enforcement leaders in Central Florida and Orange County, express our condolences to the Claremont Police Department who lost an officer to COVID-19. Our thoughts and prayers are with the Claremont Police Department and their friends and so as we continue to face the challenges of COVID-19, I want to assure you that the men and women in Orange County Sheriff's Office, as well as all the other municipalities in Orange County, are committed to keeping all of you safe. And although there have been many small victories that we can celebrate, and we are looking forward to restarting this economy and the businesses, I want to remind everyone that now is not the time to be must remain vigilant. Our deputies will continue to enforce curfews and stay-at-home orders. And the reason I bring that back up again is because you could see headlines from across the country of sheriffs and chiefs refusing to enforce different stay-at-home orders, either from local government or the state government. I want that we stand as one here with not only the local government but also our state government of the stay-at-home orders that are in place. So members of the Orange County Sheriff's Office are part of the Business Compliance Working Group for the Mayor's Economic Recovery Task Force to help ensure a measured approach to easing restrictions. And as some businesses and public spaces begin to open with various limitations, we are still urging people, for their own safety, for the safety of those around them, to limit their movement and their possible exposure to the virus. And please remember that we're still seeing hundreds of cases statewide. So it's still important, especially for our most vulnerable populations, to be protected. So right now, the nightly curfew is still in place from 11 p.m. To 5 a.m. We have, at this point, at least the Orange County Sheriff's Office, made 6 curfew violation notice to appear. We have issued notice to appears and made a physical arrest in one case, so we're still enforcing that. So again, we do not want to arrest people for violating these orders, but we will continue to do that to keep our community safe. And I think we've done such a great job in this community. You can see the results of what we've been doing is actually working and saving lives in this community. Once again, I want to mention speeding on our roadways, as there is less traffic on our roadways. However, we are enforcing those roadways because of numerous complaints about speeding. So this past week, our traffic section was out and made 200 traffic stops in various locations, 528 and 408, and issued 175 citations for speeding. And nearly 100 of those people were traveling more miles an hour over the posted speed limit. And just yesterday, a driver was stopped on the 528 for going 125 miles an hour in a 55 mile per hour zone. The driver was issued a criminal citation, and moments later, that same person was stopped by a different deputy on the 408 going 92 miles an hour in a 55 mile an hour zone. So this kind of recklessness is unacceptable, and we're actually continue that enforcement and provide more traffic enforcement out there, because that kind of recklessness is going to involve a fatal traffic crash if this continues to happen. So, but we appreciate everything the Orange County residents are doing and have done to protect themselves from COVID-19. And please continue to stay at home unless you must go out, and wear your masks if you're out in public, and wash your hands and practice good. Thank you. I'll turn it back over to Mayor Demings.
Okay, Mayor Dyer, before he leaves, if there are any questions, I wouldn't rob him of that opportunity. He has another appointment. So if there are any questions of Mayor Dyer, now would be the time to ask them.
All right.
Okay, Mayor Dyer, you're off the hook. Okay, we'll open it up to questions, and then we'll quickly go into presenting in Spanish here in just a few moments. Okay, questions? I have no idea.
And through your task force, there's been some talk of the drafted guidelines that are out there, and from some businesses who are concerned about their ability to get the needed PPE that the guidelines will likely require of them or ask of them. Do you have confidence that there's enough PPE out there for businesses in this community to be able to safely operate?
One of our emergency support functions internal to the state of emergency that we are within Orange County is working really behind the scenes to access supply chain, to be able to get the PPE equipment and supplies. We remain optimistic. I will say that many more supplies are coming into the state at this point, and then they're being redistributed throughout the state. We have a number of requests in, so hopefully we'll get additional supplies. I will say one of the reasons why we're able to increase sites this week in Orange County is because we did receive a shipment of additional test collection kits over the weekend, and we received another shipment today. So if that's an indication about the future, we realize that in order for businesses to breathe and have appropriate supplies, we want to be able to assist them to the extent that we can. So we're very sensitive to that.
With News 6. More to what Ryan was asking. Yesterday, we do know that the governor said Florida, in his mind, is ready to transition to a phase 1 of reopening. Is that what, given with what your recovery task force has accomplished already, do you stick this week?
There's no question, I think, that the state is ready to transition as a state into phase 1. However, each of the 67 counties have a certain uniqueness about that. What it looks like for each one of those counties will likely be different. Here in this county, we have been very deliberate to ensure that we have a measured approach to being able to do that. One, not county specific, but it is more regional. We have endeavored to work with the surrounding counties to make sure that we're all on one accord. And so whatever comes out of the guidelines that the governor releases, we should be able to make modifications to suit our particular circumstances here. So I believe that's what will happen. So we just a half hour, we'll have more definitive responses to you.
Okay, and with the deadline on Thursday, of course, Friday is May 1st, rent day for a lot of people. Can you talk about the rental assistance program and the response to that?
Our rental assistance program, I have been told that at this point that out of the 27,000 approximate number of applications that to date, approaching probably today somewhere around 1,000 of those individuals have been touched in some way, and checks have been distributed. There's still some challenges with the rental assistance program because of individuals who can't produce the documentation, et cetera. Some of them, in some ways, a bit of good news is they paid their April rent. And so we were, during the early phases, trying to focus on those 2 months before we went into other months. So we, as a county, it appears, we're managing the process. We had set aside $1 million to assist up to 1,500 families, and there's no question that we'll be able to meet our goal in the very beginning.
Lauren Seabrook, Channel 9. If the governor decides to let everything start opening up tomorrow or any day before the date that you all pick for Orange County, how do you plan on getting people to mind the Orange County rule, not say, well, the governor said it was fine? And I guess maybe for Sheriff Mina on the enforcement side, what can be done about that?
Well, first, I don't anticipate that the governor will do that. Because he understands that I've listened carefully to some of his briefings and other conversations that I've had with his various staff members. Understands that it takes a plan and process to reopen, so I don't see that as something that will be a reality. Of course, his executive order is due, in terms of the safe at home order, is due to expire tomorrow. We'll have to see what he decides about that. But in terms of the enforcement of it, we still will likely curfew and some other things. We'll look at what he comes out in the way of guidance, and we'll make some decisions that's, good for our citizens here in Orange County.
Yeah, so you remember before the governor's executive order came out, we had our own stay-at-home order here, as well as the curfew, and many of those violations of any stay-at-home order we have handled these past 6 months through verbal warnings, and people have been complying. So I don't anticipate any issues, and we'll just have to see what the next steps are. And but again, we're not looking to use those orders as a mechanism to arrest people, but we do want people to comply with whatever orders in place. But we'll start, with verbal warnings, and when we have done that, people have complied.
And one more question for Dr. This morning in one of the task force meetings, work group meetings, there was a debate about temperature checks. And a lot of people on the business side feel like temperature checks for customers before they come into a restaurant or business would be unrealistic. But the doctors on the call felt like that was a very important thing that needs to happen. I think Dr. Scott Brady even mentioned that if you have a fever, you're a lot more contagious with COVID-19. What is your take on this, and where do you think we should go?
So I was supposed to weigh in tomorrow, not today. So temperature is an important sign and symptom of the disease of any. It's how the body is reacting to the different substances that viruses and bacteria release in the process. It has its use, but universally use is not practical. First, because people can learn how to trick the temperature. If I want to pass a temperature check, what to do is take a pill 40 minutes before, and I will have no temperature when I get anywhere. So from that point of view, it may be not practical. The other part that is not practical about temperature check is the fact that COVID-19 is not the only disease that can elevate your temperature. So if someone was exposed to the sunlight for a while, and then come into a place, their temperature is going to be higher. So there are other steps that are easier to implement, easier to enforce, and more universal, like face covering, hand washing, glove use, social distancing. Temperature check would require thermometers that are infrared. They're right now. So we have to weigh what is practical and what is desirable, and where we land in our efforts to do that. The county task force have not released their recommendations, but part of my recommendation is also to give flexibility to the business. Although while we have a set of standards, they want to go a little bit further down to prevent and protect their investments. That's absolutely fine. And temperature check could be a way where a small business, a small mom and pop shop could check temperature for 20 people that are coming. A convention center with 10,000 people coming for a convention when that opens, it will not be practical. I'm sorry to take your time to do this, but this is also the beauty of social media. There was some confusion about what I said with regard to tomorrow testing and Friday testing. So I would like to reiterate that for those in social media that were commenting on it. Tomorrow testing at Barnett Park will be done Saturday, May 2nd, at the same location, and we will open. Friday testing, weather permitting, will continue to be at Blanchard Park.
Okay, the only other thing that I would add, reference to the pros and cons of requiring temperatures to be checked. It may be a guideline as opposed to a mandate because there are certain types of businesses that will have the capacity, obviously, to work in hospitals or medical types of facilities, doctors' offices, dental offices, that they have the ability to be able to do that. So one size may not fit all, and it may be simply a recommendation. What we're trying to focus on is the short term. To me, I define the short term as a period of time between when we see the next season, if you will, of this virus, which both would be prior to the creation of a vaccine. And so during that short-term period of time before various levels of government are able to enact laws or ordinances to direct or mandate certain things, that short period of time is where we have to give guidance to our business community about reopening and what that looks like to ensure the consumer is there to ensure that the public will feel safe going out into the public and patronizing various businesses. So what that looks like is going to be dependent upon the work of this task force that is meeting. We have some days 4 or 5 meetings each day between now and towards the end of the week, and hopefully they will be able to come up with recommendations that are logical and attainable for us in this community.
Paul Rivera, Western News. These two are for you, Mayor. So you said May 11th reopening sounds ambitious. And people might listen to that and listen to what's coming out of these press conferences and say, look, we hit our peak for coronavirus cases weeks ago. The curve has been flattened, and the hospital systems weren't overwhelmed. So why does May 11th sound ambitious?
I think in terms of in the context in which I make that statement, some people envision a total reopening happening by May 11th. That I don't think is very realistic. But in terms of the phasing in of reopenings, I think that this Friday, in just a couple of days, is May the 1st. And in order to give people ample time to prepare to get their workers back to work, to get all of the protective equipment that they need to be able to really comply with the guidelines and mandates that will be put in place, it takes some planning. Child care and all of those things have to be considered. And so realistically, to have significant businesses reopen, I just think that, and if we don't make any announcements about this until Friday, let's say the first part of next week, you can see we begin to get closer and closer to that May 11th date, and it becomes somewhat impractical. But our goal is to open up some measure of commerce as soon as we possibly can.
What's your message to business owners who say we can't hang on for a few more weeks? We may be open at the end of May or beginning of June. We can't do that. We've applied for help. We haven't gotten it.
I didn't say the end of June. That is the work of the task force, primarily your words, not my words, about how that measured approach will occur. I have family members that own small businesses, so I'm really sensitive to the plight of the small business owner and what that means to them. But I can tell you from the interactions with many of them, they understand that they have one opportunity and to reopen right. None of us want to relive going through the drastic measures, if you will, that we have lived through within the last few weeks or months. And so our goal is to shorten the probability that we'll have a resurgence of this virus in our community. While there were no hospitalizations, at least recorded, what we do know, you heard mention that there was a law enforcement officer who died recently of the COVID virus. So regardless of what one may think, it is still a virus that can kill if, circumstances. And so we don't want that for anyone in our community. And I think if we still see, even though the numbers are small, if we continue to see individuals who test positive, that means that that individual can spread that virus to others. And if you relax the sanitary protocols that we have put in place too soon, that means that the multiples of individuals that can reinfect others begins to multiply. We don't want that in this community. So I think we all understand that we have in mind here, and that is to return people to work as quickly as we can and to do it in a very balanced way. Okay. Question in the back.
Buenas tardes, Félix Pirela, Telemundo.
Buenas tardes.
Buenas tardes, alcalde. Mayor, tengo dos preguntas cortas, pues sé que ya va a hablar el gobernador de Santis a las 5. Doctor, la primera pregunta es el sitio de pruebas en la Escuela Elemental Ventura, miércoles, jueves y viernes, pero nos comunicamos con el centro de llamadas y antes de las 11 de la mañana ya se habían acabado las citas disponibles, las pruebas para estos 3 días de la semana. Queremos saber si en este punto, el más caliente de Orange, se va a expandir las pruebas para la próxima semana allí. Y la segunda pregunta, los 14 días serán, o los últimos 14 días serán analizados para pensar reabrir la economía en el Estado. ¿Qué van a ser los últimos 14 días acá en Orange, doctor?
Para la primera pregunta, la doctora Martínez, y te voy a responder la segunda mientras ella se llega al podio. Los 14 últimos días, el balance de la situación. Estamos en una situación envidiable, realmente. Ha disminuido, mira, mientras más pruebas hacemos, menos casos encontramos. Y eso es una indicación muy, muy buena. Esa es la primera. La otra es que el número de hospitalizaciones ha disminuido, al punto que el día 26 el alcalde estaba diciendo no se reportó ninguna hospitalización por y decimos el 26 porque la base de datos realmente corre 2 días atrasada para hospitalizaciones, para tenerla verificada realmente. Entonces yo creo que estamos en una buena posición para tomar los pasos que la administración está tomando para poder abrir la economía. La gente yo sé que está desesperada, pero es más parar la economía que echarla a andar. Porque la economía es un sistema de distribución y todas esas partes están integradas. Y parte de lo que tenemos que pensar, por ejemplo, cómo van a los papás ir a trabajar si los niños están en casa. No están en la escuela porque las escuelas pararon. Hay un grupo de situaciones que tienen que ser analizadas repetidamente. How can you summarize the last 14 days for the pandemic in Orange County? My answer was that we are in a very good position. We are actually in a very good position because the more that we test, the less we find. And that's where you want to be. Even when we go actively looking outside our sites and we are going into the communities, we are finding less and less cases. And also the number of hospitalization has reduced. The only thing that, and I didn't say that in Spanish, I have to say it. The only thing that I'm watching slightly is the people who are dying are getting a little bit younger as the pandemic moves. And I have to try to find out what is behind that, what is accounting for that, and compare it to other counties. So that's another job, and that's part of what we are going to do the week that we are going to hit a pause, is to analyze our data and be able to concentrate into coming with new ideas. Parte de la pregunta que no dije en español es que lo único preocupado es que la edad de los individuos que han fallecido recientemente es un poquito más baja que lo que uno pueda esperar. Y tenemos que mirar qué es lo que está pasando y cuáles son las condiciones y qué es lo que está sucediendo con eso. Doctora.
Okay, and just as a reminder, we have about 10 minutes and through this next portion, and I will, before the 5 o'clock, I know many of you are going to cut away at that point. So, Dr. Martinez, if you want to respond to the first part, and then we're going to quickly shift into the Spanish-speaking portion at that point. So, commissioners, if you all want to come on up, and Ilya Torres as well, and that way we can kind of move at this point. Okay, Dr. Martinez.
Thank you, Mayor. Tu pregunta acerca de los 3 lugares que abrimos hoy y el hecho de que se acabaron las citas ya, es que hay una gran demanda en esos 2 zip codes, como tú sabes, pero estamos buscando la posibilidad de poder expandir, ya sea hacer un poco más de pruebas y anunciarlo con tiempo el viernes, si podemos encontrar un poco más de las pruebas que necesitamos, o la semana que viene. Así que todo eso para poder servir al público de la manera que ellos necesitan.
Okay, I'm going to invite Ms. Ilya Torres to come up and to translate very quickly. Is a question in Spanish or no?
No, in English.
Okay, one more, and then we'll go to. Okay.
So how soon after the governor's announcement is the task force going to be meeting? So is it realistic to get the official county tomorrow?
The official response will not likely come until Friday. But the task force will be meeting tomorrow, multiple meetings tomorrow and multiple meetings on Friday. And so probably we just need time to digest whatever comes out. So Friday is the goal day for us. Okay. All right. And so Ms. Torres to kind of interpret, and then we'll quickly go to the commissioners who may have some comments at this point. But again, let me just welcome all of you here. Governor DeSantis will announce in just a few minutes his recommendations regarding opening up Florida.
Queremos darle la bienvenida a todos. El gobernador Ron DeSantis en los próximos minutos estará haciendo un anuncio para reabrir las operaciones comerciales en Florida.
Members of the Orange County Economic Recovery Task Force have been working furiously to come up with guidelines.
Los miembros del Grupo de Trabajo Recuperación Económica han estado trabajando arduamente para desarrollar directrices.
We have 4 working groups with the task force who have been meeting today. They met the day meet the remainder of this week.
Tenemos 4 grupos que se han estado reuniendo, se reunieron ayer, se reunieron hoy, estarán reuniéndose mañana.
The Reopening Business Working Group had experts from Advent Health and Orlando Health included in the discussion.
El grupo de reapertura de los negocios incluye representantes de Advent Health y de Orlando Health en la discusión de sus directrices.
The group to come up with guidelines for businesses to follow when they reopen.
Esas directrices incluyen guías a seguir por los negocios ante la apertura.
The Business Readiness Working Group is creating a business checklist and recommendations on how businesses can obtain PPE equipment.
El grupo de trabajo de preparación empresarial está desarrollando una lista de coteos, un banco de datos para los negocios puedan obtener el equipo de protección personal necesario.
A big part of what we're trying to do is bring back tourism, and the Bringing Back Tourism and the Business Compliance and Consumer Confidence Working Groups also met today.
Nuestra labor es reactivar el turismo y incluir confianza en la parte de los consumidores, y esos grupos también se reunieron hoy.
The entire Economic Recovery Task Force will meet on Friday at 2 p.m. To provide their recommendations.
El grupo de trabajo de recuperación económica en pleno se estará reuniendo el próximo viernes a las 2 de la tarde para discutir sus recomendaciones.
Our goal is to ensure that our residents and all people who work at our businesses feel comfortable when they go out in the public and when they go back to work.
Nuestra meta realmente es que nuestros residentes y nuestros visitantes sientan seguros cuando tengan que regresar a sus trabajos, retomar sus vidas.
And we were happy today to open additional testing sites in the 32822 and 32824 zip codes.
Estamos muy contentos de haber inaugurado de prueba en el día de hoy en los códigos postales 32822 y 32824.
One of those sites was at the South Orange Sports Complex, and the other at the Ventura Elementary School.
Uno de los centros ubica en el South Orange Youth Complex y el otro ubica en la Escuela Elemental Ventura.
And it was a great partnership between the county district and the state to deliver on those testing sites.
Estos centros fueron una colaboración del condado, del estado y de la junta escolar para lograr estas clínicas.
And at this point, I'm going to ask our commissioners to come forward if they have comments that they'd like to offer at this time. Commissioner Gomez Cordero first, and then Commissioner Myra Uribe.
Sí, gracias, alcalde, y gracias por toda la información y a la prensa hispana y a toda la prensa para informarle a nuestra comunidad lo que está pasando, ¿verdad?, con el condado y con el COVID-19. Gracias a Ilia, que ha hecho tremendo trabajo interpretando. Y para ser bien rapidito, lo más que quiero decirle es que, por favor, el toque de queda sigue. Él lo mencionó el alguacil Mina, de 11 de la noche a 5 de la mañana. Ustedes saben que ya él ha puesto más de 6 multas y también hubo arrestos porque no están siguiendo esto. Eso es bien importante que sigan esto. Ya ella repitió todo lo que dijo, lo que dijimos de los centros. Llamen al 311 para que se puedan hacer la prueba. Dios me los bendiga, Dios me los cuida y por favor vamos a seguir cuidándonos.
Buenas tardes. Para nosotros importante es seguir haciéndose los análisis. Tengo mucho orgullo en nuestro zip code de 328. Viendo esos casos y esas citas llenándose porque es importante. Hemos hecho mucho logro con el alcalde, con la comisionada Maribel Gómez Cordero, para que nuestra comunidad tenga esa opción. No necesitas el ID, no necesitas seguro. Vaya, hágase el análisis, se puede llamar el 311. Puedes caminar al lugar, puede ir en carro, puede ir en autobús. Pero es importante que sigamos llenando esas citas para poder tener una idea donde podemos lograr para abrir nuestro negocio otra vez. Muchísimas gracias, que se cuiden y todavía pasen las leyes que tenemos en estatus y a ver dónde seguimos ahora para el viernes. Muchísimas gracias.
If I may make a quick clarification. We do need IDs. The person does have to. Necesitamos que la persona sí traiga algún tipo de identificación porque estamos haciendo pruebas médicas, no es cualquier cosa que estamos haciendo a laboratorios, así que sí necesitamos que la persona produzca algún tipo de identificación. No tiene que ser una licencia de conducir, pero puede ser algún otro tipo de identificación. Es necesario. The person does have to have some type of ID with them because we're doing medical tests that will be sent to medical labs. So this is for the community to understand that we do need some type of identification. Thank you.
Okay. And there are various types of identification that could qualify under that. So. Let me just move quickly to questions. Remember, we do have Dr. Pino, we have Dr. Martinez, who can respond to any of your medical-related questions. Okay, so questions.
This one comes from Jennifer Marcial with El Sentinel, and I think it's geared towards you, Mayor Demings, but also the commissioners can chime in as well. And I think Ilya or somebody might be able to translate here for Mayor Demings. We've heard from non-essential businesses saying that they on Friday and are willing to risk fines if that is the outcome. What message does the county have for these businesses, and what do they face if they open up while not being considered essential?
Okay, a lot will become more clearer within the next hours as we should shortly have the guidance from the state itself. And then we will put appropriate measures in place. Again, our goal is to work with our businesses to reopen in a careful and safe way.
I'm sorry, Mayor. I stepped aside from the podium, so I couldn't hear the question.
Okay, so
My apologies.
the question was to some. Well, I'll let her repeat it. She's got it.
I'm sorry.
Non-essential businesses, the El Sentinel's hearing, are opening and willing to open on Friday, risking fines if that is the outcome. What message does the county have, and this includes the commissioners, for these businesses, and what do they face if they open up while not being considered essential?
Well, what I'm saying here, businesses should pay attention to the guidance that we will give at these press events and avoid any type of such calamities. And we'll know more within the next 24 hours to give them appropriate guidance.
El Sentinel reporta que hay información sobre negocios no esenciales que pretenden abrir el viernes y cuál sería el mensaje para esa comunidad empresarial. El mensaje sería que se mantenga, que se prevé que de aquí al viernes tengamos una respuesta y unas guías para ustedes, pero que no arriesguen, ¿verdad?, lo que hemos logrado.
Okay, other questions? Okay. If we don't have any other questions, then we will conclude the press event. Again, thank you all for being here. Muchas gracias and hasta mañana.